Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, this is a one-liner emergency treatment of acute heart failure. Emergency treatment of acute heart failure is managed by. If you see this, emergency treatment of acute heart failure is mainly managed by increasing it is mainly managed by dobutamine. Why this dobutamine is actually a selective beta 1 agonist? Because it is a selective beta 1 agonist, it is best in increasing cardiac output and lowering the peripheral resistance. Thank you for watching.
Thank you and thank you for watching.